Okay, let's continue with the routes of drug administration. And we are in the next route of drug administration. This is parenteral route of drug administrations. As the name suggests, parenteral means apart from enteral, a route apart from mouth. So here we are administering a drug by injections which take them directly into the systems, where to the tissue fluids or into the blood without having to cross the enteral mucosa, means gastrointestinal mucosa. So here we are injecting drugs directly into the systems, and here there is no oral route, so no gastrointestinal mucosa comes into the picture. So what be the main advantage? Main advantage would be the high bioavailability. Okay, so if you are administering 100% of a drug in oral route, there are chances that only 75% of drug reaches to the systemic circulation. But here 100% of drug reaches into the systemic circulations. So high bioavailability, that is the main thing. Rapid action, so in emergency you can use this route. No first fast metabolism, so there are no chances of drug loss. So it's suitable for basically patients with vomiting or unconsciousness, where you need to give immediate treatment. Irritant and bad taste drugs, where palatability is a problem, where the drug is gastric irritant, like for an example chloroquine like drugs, anti-malarial drugs which are very irritant to gastric mucosa. And there is no chances of food drug interactions. There are patient complaints when to take drug with, is it we need to take with food or after the food. Here there is no question of it, so there is no food drug interactions. What are disadvantages? If you give drugs through injectable route, there are chances of infection at the particular site. There need to be sterilizations. All the different parts of injections need to be sterilized properly. It's an invasive procedure, so skilled assistance is required through nurse or paramedical staff. It's a painful condition, bit of pain would be there, and if more infections, more pain would be there. It needs skill, and there are chances of some anaphylactic reactions or immediate hypersensitivity reactions. It's a bit expensive as well in comparison to the oral route. So these are different disadvantages of parenteral routes. These injections or the parenteral routes we are providing, we are having different formulations for it. For an example, if we see a tiny bottle kind of a structure, this is ampule, where we need to break from this mark, and the drug we need to utilize in single use only. Okay, all the drugs we need to utilize in single use, otherwise we need to discard that particular bottle. We have IP infusion there, we have bottles in there. Through IV sets, we are infusing the fluid at particular rate. We have vials, that vials may be available in the drug available in the powder form or liquid form. We need to take the drug particular amount which is required, and then we can reuse them. So difference between basically vial and ampule is ampule cannot be reused, while vial can be reused. So there are different injectable formulations available. What are important parenteral routes? Important parenteral routes are mainly four. First is intradermal, where the name suggests dermal means skin. So we are injecting drug into the skin which is the very superficial layer, epidermis and dermis. So here we are injecting, A is been indicated, where we are injecting drug into the skin. So very parallel to skin, a needle is been punctured and drug is been deposited there. Second route, where B suggests, is subcutaneous route, where the drug is administered into the subcutaneous tissue or the fat, where the needle is bit a straighter angle. Third is intramuscular route, where we are introducing needle into the muscles. Okay, so needle is now into the muscles, where we are injecting drugs directly into the muscles. And fourth is intravenous. So this is a vein and we are introducing drug into the veins, so placing a drug directly into the bloodstream. So there are different routes of drug administration in parenteral aspect. So let's first talk about intravenous route. Okay, so what are advantages of intravenous route? It's the most commonly preferred parenteral routes, which is not been absorbed orally. Obviously, it avoids first pass metabolism. And intravenous drug delivery permits rapid effects and maximum degree of the control of the circulating drugs. And we can titrate the dose response as well. We are introducing a particular needle into the intravenous system, and we are introducing drugs, so we can change or titrate the drug, or decrease or increase the concentration or amount in the drugs through the regulators. Even if we need to give larger quantity of drugs, we can provide, for an example, in case of blood loss, or in case of fluid loss, for an example, nausea, tremendous vomiting, tremendous diarrhea. We need to infuse a larger amount of a fluid. We can infuse those fluid or a drug with a comparatively lesser pain. And obviously drug directly reaches to the systemic circulation, so 100% bioavailability. And absorption phase, which mainly a big hindrance in case of IV, in oral route, is been bypassed. What are disadvantages? It would be the same. Unlike the GI tracts, we need to inject the drug, so obviously the drug which goes into the circulations cannot be recalled by strategies such as emesis. For an example, if we have introduced a larger quantity of a drugs through oral route, we can give emetic agents or induce the vomiting, so all the drugs can come out. But here we are introducing drug into the system, so once the drug goes into the system, it's very difficult to decrease the amount of drugs, because it is directly exposed to the system. Only thing now we can do is we can give antidotes of that particular drugs. IV injections also induces the hemolysis, which is mainly the lysis of the RBCs, and other adverse drug reactions like immediate hypersensitivity reactions if we deliver drugs too rapidly or a higher concentrations. So it affects vital organs like heart and brain as well. Thrombophlebitis is a bigger problem. If you have seen, if you've been admitted for particular condition in the hospital, and the IV cannula has been inserted in your vein, after 1 or 2 days, that portion where the IV cannula has been inserted becomes painful, swollen, red. That is because of thrombophlebitis. It's an inflammation of those particular veins, and that produces mainly sometimes it may produces necrosis as well. So tremendous pain would be there. And there are chances of air embolism. A lot of air, if gets injected into the system, this can produce embolism, and this can stuck into the particular arteries and produces dangerous effects. Here we need to understand two important terminologies. First, what is bolus? Bolus means lump sum amount of drug is been injected. For an example, in case of emergency, we give some drugs through IV route. So here a particular amount of drugs is been totally injected. For an example, 5 ml or 10 ml. What is infusion? Infusion means drug is been given slowly over the period of time. For an example, if we need to administer IV fluids, or particular drug which has been dilated into those bottle of the IV fluids, is been given through the period of 6 hours or 10 hours or at least 2 hours, and so the drugs goes gradually into the system. So that is infusion. And first one is bolus, where the particular amount of drugs been injected into the system. Now second route is intramuscular, wherein we need to give the drugs into the muscle. So which muscles are suitable? Mostly large muscles are suitable. These are deltoid on arm, triceps, and the main important is this gluteus maximus, rectus femoris. So these are big muscles, and these big muscles are suitable for administration of drugs. Sometimes depot preparation can also be given. What is depot preparation? Depot preparation means we are introducing drug into the muscles, which remains there, which gradually absorb into the system, and these drugs gradually released into the system, so the drug concentration remains into the blood through a longer period of time. So some anti-pregnancy or anti-fertility drugs we've been giving in the depot forms. So some hormonal injections we give in a depot form, where female needs to take these drugs only once in 2 months or 3 months. So it's very beneficial for them. It increases the patient's compliance. What are advantages? Absorption is reasonably uniform, comparatively rapid onsets, and less irritant. Obviously, comparison to oral, first pass metabolism is avoided. But disadvantages would be, again, up to 10 ml of drugs can be given. If you give into the muscle, there are chances that muscle pain would be there, and sometimes abscess formation and infections would be there. There are few nerves going around that particular site, so you might damage that nerve. There would be chances of collection of blood and produces hematoma, and obviously you need an assistant, so the treatment would be expensive. Third would be subcutaneous. As the name suggests, we are introducing drug into the subcutaneous tissue where mostly fat is been there and rich nerve supply, so irritant drugs cannot be injected at that site. It's comparatively less vascular, so in comparison to intramuscular route, the absorption is bit slower. Avoid basically in shock patient. This is most important. Why you need to avoid this subcutaneous route in shock? Because there is already vasoconstrictions there, so the absorption chances would be bit less, and only small volumes can be injected. Subcutaneous injections minimizes the risk associated with intravascular injection. So here comparatively patient can also take by themselves. For an example, the best example here in this case is insulin. So most of the insulins, apart from first or second visit, now patient takes by themselves only. So you don't need particular assistant. You can self-administer those drugs. That is comparatively very easy, and insulin syringes or the subcutaneous syringe is also available, where the needle can only prick up to the subcutaneous tissue only. So it becomes easy for a particular patient by giving drugs into their body as well. Depot preparations also available, dermojet, pellet implantation. We'll talk about them in later part. What is dermojet? Here the needle is not used. That is a gun-like device where needle is not been there. So high velocity jet flow of a drug is being produced, and there are many tiny particles which is being produced of that particular drugs, and at a higher rate these particles goes into the subcutaneous tissue, and mass inoculations or vaccinations program, these dermojets in Western countries are quite useful. Second is pellet implantations, where this kind of pellet or smaller capsules, you can say, is been introduced into the subcutaneous site through incision, and through the needles, through hollow needles, it goes into the subcutaneous space. Biodegradable and non-biodegradable implants. So this kind of capsule is been introduced into the subcutaneous tissue. This may be biodegradable, so no need to remove it, and sometimes non-biodegradable would be there, so you need to remove those after its effects ends. Intradermal route. Here the needle is been introduced into the dermis or the skin, so there is chances of raising of skin. So here there would be raising of skin, and this is most commonly used route for giving vaccines or for sensitivity testing of some drugs like penicillins. So takeaway message is, no single method of drug administration is ideal for all the drugs. We need to choose a particular route according to patient situations and the circumstances. Thank you very much for in this chapter. If you are having any queries, you can comment in the comment box and I will try and solve.